An integrated data management strategy is critical in a hospital environment. The clinicians and hospital personnel have to be able to gain access to all levels of patient information, from unstructured to structured, from PACS systems to EMRs. 80% of all the data that exists in this environment is unstructured. It's quadrupling every 2 years. It's critical to create a holistic patient view, a longitudinal record to treat patients in the utmost efficiency and time. Safety is a primary concern, the ability for clinical workflow and practice management. So a real-world example is a emergency room visit where time is of the utmost essence. They have to have the clinicians and staff in that setting need real-time information. If someone's coming in from Lifeline or someone has, a clinical condition that has no time to react, you need all the longitudinal records immediately. This could even be seen, you could take this example to a next level and say in operation theaters, the surgeons actually need access to the very latest conditions and diagnostics of the patient before they start their surgery. This is a reduction of medical errors and obviously patient safety. So the integrated approach impacts clinical workflow and practice management basically in a timely fashion. So clinicians, nurses, physicians, anyone that has the need to access a record of any sort will need to have that record available in the time that they need it for decision making. So when you say, I need a PACS image, I need something from an EMR, these things are usually not readily available under the same umbrella, the same viewer. They're on different floors. This really impacts the ability to treat in the speed that's necessary, and also this impacts unnecessary procedures in a hospital environment. There is many billions of dollars wasted in the year, any calendar year, for unnecessary procedures, and hundreds of thousands of deaths because of medical mistakes. 1 in 10 people actually in a hospital environment will experience a medical mistake. These are kind of staggering numbers, and they all come down to the ability to get the right information at the right time. So information management from an integrated perspective is really important for an overall experience that the customer or patient has during their clinical stay. So patient experience management is kind of a new discipline that is pervasive now within the walls of a provider setting. CIOs and CEOs actually rank it second or third in their priorities for the calendar year. And this is because patients have a choice. They can go to multiple institutions for their care. So now the providers are acting as a service provider, not just a clinical provider of care. When you go to a hospital setting, you just don't get a diagnosis. You have nurses, you have ancillary, occupational, physical therapists, whatever the issue is. You're having an experience, and it's necessary to provide a good one. So the integrated approach for this information completely impacts the experience. Having access to the right data at the right time plays a part in admittance and discharge and stay, overall stay. And obviously there are going to be surveys and reports back to the institution to rank them in their level of experience. Then you have the natural segue of discharge and the need to provide secure access to the records given to the patients. This could be in a physical format, it could be just getting any particular record from labs to clinical or EMR level information. And then you can take it a step further where enabling cloud technologies need to be employed. So one after another, we see the need to be secure, private, HIPAA compliant, and all the other regulatory agencies that come in, and ultimately for the patient to have access So our repetitive theme is access, timely access, secure, safe access to patient information.